In the whole of Northeast, we don't have any child institute. And they said, what do I mean? I say, can't we have one in UMTH? Having an institute where everything of a child will be there for training and for research.
This is the outborn special care baby unit. It is a neonatal unit, so we cater for children less than 28 days of life.
I am Professor Joseph Kwanimba. I'm the director of the Child and Adolescent Health Center. Yes, it was a concept that I had a long time ago. Then I met the CMD. Then he was the provost, and with the DVC. Then was DVC, not DVC. And I said, in the whole of Northeast, we don't have any child institute. And they said, what do I mean? I said, having an institute where everything of a child will be there for training and for research. Since we don't have the whole of Northeast, can't we have one in UMTH? We have, well, basically I would say there are various departments. Because I can't say 1, 2, 3, we have almost 5 departments here. We have the surgery, pediatric surgery. We have the pediatric medical. Then we have the common people who are here doing the immunization, good monitoring, etc. Then we also have the child health dental units. You get that? We have the radiology, pediatric emergency, that's pediatric neurological center. So basically there are 5, but we have the other ones also that they come in as we deem it fit. We have 150 bed space capacity in this center. 150 bed space capacity.
Okay.
Yes. Before, where we were before, it was only 64. But now, because of the increase in bed space, we have 150 bed space. The latest facilities, or the facilities that we have on ground, I wouldn't say they are latest. Because if you talk of latest, you're talking of the world standard latest. And we don't produce equipment here, but we have at least some facilities that is being upgraded that will be able to meet the world standard. For instance, now we've all gone digital. Patients come in, they have their digital records. Even the clinic we have digital records, so that this actually will maintain the records, not that we'll be losing records. When patient comes for follow up, no matter how many years, we'll be able to have records of what we're having, and we'll be able to project what we're having. That's one aspect. Now the critical care, that's the emergency units area, we also have some of those gadgets that when the patient is very critically ill, we give place of monitors, so that they will be monitoring, they'll be giving us their vital signs and what it needs to be, so that they will be able to manage them appropriately. Once they're better, they are moved in. Now we have the outborn care baby units, where we have some equipment that have been given and the management bought some, where we have the incubators, and with the incubators you have the ventilators, you have the monitors, so that when they come in, those who are critically able manage appropriately.
So this is the outborn special care baby unit. It is a neonatal unit, so we cater for children less than 28 28 days of life. So because they are so small, we have a lot of equipment we use to take care of them. To my right here is an infant incubator. So it's a place where we keep babies that are born before time. Because for some reasons they are born before time, so they require some special care to help them to adjust to the outside life. So it's called an infant incubator. So it protects them, provides warmth for them, and some other additional things. Above it is a form of infusion pump, call it infusion pump. In other words, when you go adult world, you see drip hanging this way, but this is an infusion pump because they are so tiny and they are very critical. So we need to be careful with the way drugs go into them, the way fluids go into them. So this is a nice form of giving them fluid. So it gives fluid at a specific rate, okay, and is more accurate being an electronic device instead of human eyes and human hands being used to control the flow of the IV fluid.
And we also have the radiology department, where we are trying to see that every child that comes in will be catered for. We are also planning to still have the laboratories where we're going to collaborate with. We want to collaborate with WHO and other NGOs to assist so that we can have latest equipment to take care of patients, especially children coming in, like the malaria area, like the sickle cell patients that come in. We have a lot of sickle cell patients.
This is another form of infusion pump, so there are different needs, different brands. This is a handheld pulse oximeter because we are using those gadgets to support their respiration. So we need something to guide our treatment to know that they are getting what they are supposed to get. If we place a child on oxygen and the child has problem, we need to know how much of the oxygen is getting into the system. So this is called a fingertip pulse oximeter. So it's going to tell us how much oxygen the baby has and it guides us. If it is low, we know what to do. If it is getting too much, we also know what to do. So it guides oxygen therapy and also helps to monitor the oxygen concentration.
So these are some of the things that we are still trying with the management, with other WHO and other NGOs that we are able to assist and put this center so that any child comes, it's a complete burst on one side without going on the other.